Well, we also provide you with valuable information from industry professionals like my next guest. We have Dr. Andrew Kaczynski. He's a certified plastic surgeon who is changing lives for women and men. His unique and innovative approach is not only improving and enhancing how his patients look on the outside, but he also helps them with their value within. So Dr. Kaczynski, thank you so much for joining us.
You're very welcome.
And I'm very curious to find out about how you approach this, because I understand that it's called Advanced Concepts in Plastic Surgery. So tell us about that.
Well, the reason it's called Advanced Concepts is because they really are advanced concepts. My practice is a state-of-the-art cosmetic practice, plastic surgery practice, that emphasizes the latest techniques and also the latest philosophies. Things like minimal incision surgery, things like filling and fat grafting instead of pulling people real tight, all sorts of different lasers for doing the procedures and for healing. So everything that we use is truly advanced.
Okay, and you are a certified plastic surgeon. What's the difference between that and a cosmetic surgeon?
Well, this could actually go into a very long discussion, but I'll give you the short version, and the best way to talk about it is to talk about myself. After medical school, I did 5 years of general surgery training, then 2 years of plastic surgery fellowship. After that, I had to take a written exam, an oral exam, present cases, and be scrutinized for ethics by something called the American Board of Plastic Surgery. At that point, I was board certified. Cosmetic surgeons do not have a recognized board. So you can become a cosmetic surgeon after a weekend course or a 2-week course somewhere. So the best way I can explain it is, do you really want to have a carpenter do your electrical work in your house? Or do you want the guy that's flying you to Hawaii in the 747 just having had a 2-week course in how to fly a 747?
It comes down to credentials.
It does.
It comes down to the amount of time that you've studied and your credentials that you have. Okay, and I see that you've brought some tools here with us today. So go ahead and show us what you've got here on the table, because it's very interesting. Well, and a little intimidating, I have to say.
I've been doing liposuction for over 20 years. I learned from Dr. Illouz, who invented it in Paris, France. And back in the day, these were the instruments that we used. They were kind of scary looking.
Yes.
And that was the state of the art back then. And unfortunately, they also caused complications and things like that. So where we're going now with the latest procedures that we use, the laser procedures, this is a 2mm laser probe. This is what we use.
Considerably different.
To melt the fat. The incisions are so tiny you can barely see them. The actual cannula is also very small, so the procedures are much more benign. They're easier to do for the doctor. They're easier to recover from for the patient. It's an absolute world of difference from when we first started with liposuction.
And I understand that you offer some groundbreaking procedures. Can you tell us about those?
I do. I've been doing liposuction, as I said, for over 20 years. I've used every single technique that there is, including regular liposuction, tumescent, various different kinds, including ultrasonic, Vaser, and now the SmartLipo. One of the great things that we do is we do something called liposculpture, which means that we actually use the tools to reveal the muscles of the body. So interestingly enough, the patient that we just saw was a gentleman who was pretty much a gym rat, but he had so much body fat, there was a genetic problem that he could not shake it. So we actually shaped his body. In the ladies, it's not so much emphasis on the abs, but on creating a waistline. And with creating those waistlines, we give people the look that they're looking for, and we take up where the fitness people leave off. And it's not that they don't do a good job. Some people are just genetically incapable of responding to a fitness program. They can be fit, they can be strong, but they can't shape themselves up. And that's where I pick up the slack.
And if people are interested in this, where can they get more information?
They can call my office, 916-925-5522, or drkmd.com.
And Doctor, I know we have a lot more to talk about too. So when we come back, we'll continue our discussion with Advanced Concepts in Plastic Surgery and learn more about their innovative beauty procedures that's transforming lives. Very interesting. I can't wait to hear more about what you have to say.